Right, now ladies and gentlemen, for our next session, it's no longer lightning, so the speaker can come down and we can come down too. For Town Hall Session 3, talking about visual informatics, please welcome Professor Dr. Hamzaini Abdul Hamid of UTM.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. And very good afternoon to everyone. My screen still not coming up yet. Okay. Can you hear me? Of course. Let me first of all, I would like to thank the organizing committee for Myran 2016 for inviting me to talk on this afternoon. My topic will be interdisciplinary research between visual informatics and medicine, bridging the gap. I'm from medical faculty, University Kebangsaan Malaysia. So the faces that I see today is not familiar to me because we are in Cheras, and I hope this will be one of the lecture that would give some information on how visual informatics and medicine can work together and can produce a good research. Okay, first of all, definition. I'm sure you all know about visual informatics or information and also medicine. So basically, anything visual, any information that comes as a visual component would be visual information or visual informatics component. So and also medicine, of course, the science of practice in the diagnosis of treatment of disease in patient. So why we need each other? Why collaboration between not only visual informatics but also other information technology or IT or any other or even engineering is important to work together with medicine? Because if you look at the slide, so I just put a line between medical faculty or medical fraternity and also Visual Informatics Institute. If we separate them, I'm sure we cannot understand each other. The researcher from Visual Informatics Institute will not understand what the clinician or the physician want. What is the problem within our practice as a doctor? And for medical faculty also, we as we work, we experience some problem, but we don't know how to solve the problem. So that's why the barrier should be removed. So we have to work together. We give input. We give what are the research questions, what are the problems that we encounter every day while we are treating patient, while we are investigating disease. to the person who are doing a research in the lab, so that the information will come back to us. So and there will be some improvement, and then the problem that we encounter while we are treating the patient or we are dealing with patient can be solved. Okay, I just would like to give you some history in medicine, how research in medicine evolved and how it improved the patient management and also patient investigation. I'm sure everybody know what is this. This is a stethoscope. So basically you use that to listen to the patient's chest and also listen to the patient's heart. But before this stethoscope was invented, this is how the doctor were listening to the patient's chest. So basically they are just put their ears at the back of the patient and listen the heart sound, listen to the chest, whether there's any problem or not. Some patients are, I think most of patients are uncomfortable with this situation. So that's why Dr. Linet, basically a French doctor, who feel very uncomfortable to listen to the patient's chest while treating the patient. So one day he went to visit a patient, and he has to listen to patient's chest. So what he did, he just rolled a piece of paper and put at the back of patient's chest and listened. So and he noticed that the sound that he heard is even louder than when he put his ears to the patient's chest. So this is where the stethoscope starts. So, but now, even today, not only you listen to the heart sound or to the chest, but you can also, with the information technology or with the advancement of technology, you can put an ultrasound probe to the chest, and you can see the heart beating. Not only the sound, but you can see the video of how heart is beating. So this is the advancement in medicine, and it will not be realized or it will not be achieved if we do not have a collaboration or research collaboration between physician or medical faculty with other faculty like Institute of Visual Informatics or engineering faculty. So visual information or visual informatics, I would like to bring this video because I think there is some information that can be, we can get from this movie. This is Nujum Pak Belalang. I'm sure some of you have watched this movie, but I just want to...
Kami datang kemari ini Pak Belalang ada ajar, tak pada ceritakan. Hamba dah tahu semuanya. Dah tahu kehilangan. Ya. Betul. Dengan lembu. Dari mana Pak Belalang tahu? Maklumlah, ahli nujum. Ya, ahli nujum ya. Pak Belalang, ya, boleh tak tolong tilik sama ada dapat balik lembu dengan kambing itu? Tidak. Kalau nak tilik boleh juga. Belalang? Ya, Pak. Bawa segeluk air. Periuk apa ni Pak Belalang? Ini bukan periuk tu. Ini geluk jambi. Oh, geluk jambi. Hai. Cuba lihat tu. Nampak bayang-bayang tak? Lembu dua ekor, kambing dua ekor. Cuba lihat baik-baik. Itu. Tak nampak apa-apa pun Pak Belalang. di dalam amalan hamba. Jikalau siapa tak dapat melihat bayang-bayang di dalam geluk jampi ini, orang itu anak di luar nikah. Ya. Hamba nampak. Hamba nampak. Itu dia 2 ekor lembu.
Okay, this movie, I bring this movie because I just want to show that not only in modern medicine, visual informatics will help us, but also in traditional healer, because they have a bowl of water and they can see whatever disease that the patient has. So this is part of the visual information that the traditional healer give to some of the patients who come and see them. Okay, although it's not true. I would like to also highlight the discovery of X-rays, which is very important in medicine. And I would like also to highlight that the discovery of X-ray is not done by a doctor, it's done by a physicist. So it again shows how the technology or the information that we get by having X-rays would help the patient. So you just imagine that you have a hand which you can only see the surface of the hand, but you don't know what is going on inside. You probably can guess what is happening inside the hand if there is any swelling or pain, but you don't know what is exactly happened. But if you put an X-ray, then you will see what is going on. So this is an example how a physicist or engineer or a non-medical doctor can help us in discovery of X-ray in 1895. And he won a first Nobel Prize in Physics in 1901. So and then discovery of CT scan was actually by a British engineer, Sir Godfrey Hounsfield, in 1971, and he won a Nobel Prize also in 1979. And discovery of clinical MRI, the contribution of these two scientists in developing of clinical MRI, bring them to won a Nobel Prize in Physiology and Medicine in 2003. So this show that collaboration between, I'm sure if they are doing it on their own, they will not, they cannot apply this to patient or to the medical practice. So they need a collaboration, discussion, and also research between physicists and also physician. Okay, and if you look at our body, so basically, if you look with your naked eye, what you can see is just a surface structure. You can see a skin, but you are not sure what is going on inside the body. So with the discovery of all this technology, it helps a lot in how physician treat the patient. So the physician can just feel what is going on inside the patient body, but they don't know what is exactly happened inside the body. So, so the discovery of X-rays can give you some clue or some information what is going on inside our body. And then the discovery of CT scan also give you some further more information, better than X-ray. You can see more structure inside your body, and you know what is going on with each organ in your body. And ultrasound can also give you information, because you can see what is the structure like. If there is any abnormality, then you will see it. And last is MRI. MRI also will give you information similar to CT scan, or sometimes maybe more than CT scan. But the advantage of MRI and ultrasound is it is not ionizing radiation, so it is not harmful to the patient. So what do we expect? What do we expect as a result of smart collaboration between medicine and other faculty? For example, IBI or Institute of Visual Informatics, Engineering, or even Science and Technology. So this collaboration will help us to improve the diagnosis of patient. How we improve the diagnosis? By improving the resolution of the image. The image is now getting better and better, clearer and clearer. So if 10 years ago, the image of CT scan is blur, some small structure you can't see, but now with the improvement of the technology, you'll see a better image, a more high resolution image. And then the scanning time will be faster so that the patient will not suffer while they are in the CT scan or MRI. And then with the advance in technology, you will give less radiation to the patient, which is very important, especially a patient who need multiple X-rays or multiple CT scans. So by this collaboration also, you will improve the patient treatment. We will get a more accurate treatment by having more accurate or high resolution image. Then the treatment will be more targeted treatment. And then with the advancement in the image quality, you can use imaging techniques to guide you to start the treatment. And of course, if you treat a patient accurately, you'll get less complication and the patient will get less pain. And at the end, what we want is to improve patient outcome. So by improving the diagnosis, improving the treatment in the patient, you actually improve the patient outcome, which is what we want at the end. So I would like to highlight a few of our research between medical faculty and also Institute of Visual Informatics, UKM. So basically, one of our research is on orthopedic image processing or automation. And all the image that we need is the DICOM image, which is good for manipulation. We will use CAD in manipulating of the images, and then after that we'll do the automation, simulation and visualization. Research grant that we got, and the outcome of the research, we produced a few software, which is auto knee, auto hips, auto shoulder and also auto elbow, and we produced 3 master student and 2 PhD student, and publication as well. So this is the research member between IBI and also medical faculty, and some example of our work. So as I mentioned, we produce auto knee, auto hips, auto shoulder and auto elbow. This is shoulder. So basically we use an X-ray to help us, to guide us to get an appropriate size for implant. This is the implant in the destroyed shoulder. Okay, and and we also use the software to help us to do a replacement. This is the destruction of the head of the femur, and then because this head of femur is already destroyed, so it needs to be replaced by a prosthesis to help the patient to walk. So so we use before we design or we develop this software. So basically what the clinician do is they will put an X-ray and they will have a transparency of the prosthesis. This is actually a transparency, a piece of plastic where they put a drawing of the prosthesis, the size of prosthesis, and they will put on the X-ray film. So by doing that, you will get the appropriate size for the patient to get the prosthesis of the hip replacement. So this is a bit tedious and sometimes may not be that accurate, because the x-rays, you must remember that the x-rays sometimes may be magnified depending on the size, depending on the distance of the patient to the receptor. So sometimes when they open, the size is not appropriate, they have to replace it with the other size. So, so by developing this system, so basically the image that we have is a digital image in the DICOM format, so that the measurement or the size of the bone is 100% similar to the size of the patient. So, and then we will use this image to get a digital templating, so that we'll get an accurate size for the patient rather than putting the transparency. So these are the process that occur during this process. And the other software is Otoni, same as HIP. So before this, the X-ray of the knee is put on the illuminator, and then we'll put a transparency, get a proper size for the knee replacement, then order the prosthesis, and then operate on the patient. So by by having this software, we actually using this digital image and get an appropriate prosthesis, the size, the shape, so that the patient will get the appropriate prosthesis for the knee. Okay, a future research opportunity, I'm sure there will be a lot more opportunity between medical field and also visual informatics. Not only visual informatics as I mentioned, it may be with engineering faculty or any information technology faculty. So as long as we can work together, we can talk to each other, you can come, or we can have a discussion. What are the problems that we encounter when we treat the patient, when we see the patient, so that the problem can be tackled, can be identified, and you as the expert in the digital images or signal, in the visual informatics expert, can identify what is the problem and can help us to treat the patient. At the end, what we want is by this collaboration, by this discussion or collaboration, is actually we want to improve the diagnosis of the patient and also improve the patient treatment, and at the end to improve the patient outcome. And these are the three things that I think if we do any research collaboration, we need to highlight that whatever we do should improve the patient diagnosis, should improve patient treatment, and also should improve the patient outcome. And these are a few ideas. What we can do is to improve image resolution. So by doing that, we'll get, by improving image resolution, we'll improve the patient diagnosis. And we can also do a faster imaging technique by improving the image quality, so that the scanning that we do is faster than what we do now, especially when we are scanning the pediatric patient. They cannot stay still for some time, so they can only stay still for a short period. So if we can enhance or we can improve in the timing of the scanning, then that will be great. The other thing is what we can do is to enhance more of a non-ionizing radiation research or imaging. So basically try to improve in ultrasound, try to improve in MRI, so that we are less dependent on the CT scan, which have a lot of radiation to the patient and produce low radiation. And if we need to do a CT scan, then we should have a collaboration or research how to reduce the dose to the patient if we are doing or we are scanning the patient with CT scan. I think digital archiving system is also important. We need to have a good one so that we can do a library, digital imaging library, or digital imaging exam film, and so forth, so on and so forth. And then also automation of the treatment. For example, just now, the auto knee, auto hips. Basically, we are doing automation. Instead of doing it manually, then we are using the software for the software to detect what are the appropriate size for this patient. There are a lot more procedure that we as a doctor doing manually now, so that I think there are more research opportunity that we can do so that we can improve the patient treatment at the end. Okay, so at the end, I think research collaboration is very important. We cannot work alone. I think we have to work in a team. We have to do a research collaboration, a discussion, so that you know what we want to improve and what is our problem while we are treating the patient. So with that, I thank you very much.
Thank you, Professor Dr. Hamzaini Abdul Hamid. Do we have any questions from the audience? Yes, please. The mic is over there.
Assalamualaikum. I have one question. When you mentioned about bridging technology and medical, I'd just like to know about privacy, patient privacy, when it comes to information. For example, the images from CT scan, all of those. So people from the technology, do we have to go through the same like ethical clearance like people in medicine?
Okay. Yes. So all our collaboration, we have to go through our research committee in our medical faculty. Although in the initial part, when we give images, DICOM images to our friend in IVI, we anonymize, there's no names. But having said that, the DICOM component itself, the name is inside the images. But on the image itself, there's no name. So we try not to give the patient's name. But definitely, they have to go through a research, medical faculty research committee.
Okay. Any more questions? Do you have any more questions? No? Thank you very much. Professor Dr. Hamzaini Abdul Hamid from UKM.